Hi, my name is Tanaka. I'm a clinical medical assistant with the ROP program here at the Riverside County Office of Education at the Murrieta Valley High School. I'm going to do 3 procedures today. I'm going to test the sugar in the blood. My second procedure is going to be an injection. There are 3 types of injections. There's intradermal, subcutaneous, and intramuscular. So intradermal is within the skin. It's at a 15-degree angle and it goes right in the forearm. And then I'm going to be doing, then there's the subcutaneous, which is in the fatty tissue under the skin, and then intramuscular, which is within the muscle. And there are 3 types of sites for intramuscular. There's the deltoid, vastus lateralis, and gluteal. The third procedure is going to be a blood draw, which is also known as a venipuncture. I'm going to be performing a blood sugar test, which tests the sugar in the blood. And with that, I'm going to need a lancet and a glucosometer. All right, first I'm going to call back my patient. Devin? All right, we're going to go back here. All right, can I get your name and date of birth?
My name is Devin Milligan and I was born April 4th, 1997.
Okay. So today I'm going to be performing a blood glucose test.
Okay.
You can go ahead and stand up back to me if you like. First I'm going to sanitize my hands to prevent any transference of infection. Okay, so the doctor has ordered this procedure to check your glucose in the blood. It's to check for diabetes mellitus. And first I'm going to sanitize your finger. Which is your dominant hand?
Right.
Alright, I'm going to use your left.
Okay.
Alright, and I'm going to use one of these fingers. Use the non-dominant hand and one of the non-dominant fingers to perform the test. Alright, I'm going to twist this, take it out. Alright. What you're going to do is make sure that it's horizontal across the finger like this. Poke. For the first drop of blood.
There you go. Oh, sorry.
It's okay.
All right, go ahead. Press it.
Okay. 98. So for injections, we have 3 checks and 8 rights. The 3 checks are first, when you get the medication from the cabinet, you check for the right medication, the right dosage, and the expiration date. And then you do the second check when you draw up the medication. Check for the right medication, the right dosage, and the expiration date. The third time you do the check is when you put the medication back in the cabinet. Check for the right medication, the right dosage, and the expiration date. The 8 rights are the right medication, the right dosage, the right time, the right site, the right route, the right technique, the right patient, and the right documentation. There are 3 types of injections. There are intradermal injections, which is within the skin. It goes at a 15-degree angle, no aspiration, and you do not massage the injection. The second injection is a subcutaneous injection, which is under the skin. You go at a 45-degree angle, and you go in the fatty tissue of the skin. And you do aspirate that, but you massage lightly the injection. And then you have an intramuscular injection, which is within the muscle, and you do that at a 90-degree angle, you aspirate, and you massage the injection with force. And there are 3 types of sites for intramuscular injection. There's the deltoid, the vastus lateralis, and the gluteal. There are different sites because there are different effectiveness of medications in the different routes. Sean? Okay, can I get your name and date of birth?
Sean Cunningham, 10/25/94.
Okay. So today I'm going to be doing an intramuscular injection. It's going to go in your deltoid right here. It's for your flu shot. The doctor ordered it. Alright, first I'm going to sanitize my hands. put on gloves for safety precautions for both me and the patient. And for this injection, I'm going to need a syringe and a 23 gauge and 1-inch needle. Okay, I'm going to grab some cotton balls, a Band-Aid, and alcohol wipes. Okay, so I'm going to perform my 3 checks. I'm taking the medication out of the cabinet. I'm going to make sure that it's the right medication, the right dosage, and the expiration date. Alright, and then I'm going to wipe off the top of this to clear it of any debris. And before I draw it up, I'm going to check again the right medication, the right dosage, and the expiration date. I'm going to put my needle on my syringe. Okay. I'm going to be doing half a cc or milliliter. Let's make sure there are no bubbles in the medication at all. CDC needle stick injury prevention. Let's make sure that this has a safety lock. Prevent the needle from being towards your finger. Okay. Now for my preparation for the patient. I'm going to have a Band-Aid at the ready because it's going intramuscularly. Okay. Cotton ball. Alright, and then my last check is make sure it's the right medication, right dosage, and the expiration date before I put it back in the cabinet. And now we're going to the patient's room. Can I get your name and date of birth, please?
Sean Cunningham, 10/25/94.
Okay. I'm going to give you a half cc of flu shot. Okay.
Have you done this before, Sean, huh?
Mm-hmm.
Sanitize the area. Okay. So, make sure I have my sharps container at the ready. Okay. It's going to go intramuscularly with 3 fingers. Okay. You're going to feel slight poke. Aspirate. Then inject. Okay.
Good.
Lock the needle immediately. You aspirate the needle to make sure that you haven't hit a vein. And if you have aspirate blood into the needle, you throw the needle immediately away. Okay. Tie a tourniquet, about 4 fingers for the antecubital region. Okay. Okay. Make sure that the bevel's up. You're going to go down 15-degree angle. Stabilize it. Okay. There we go.
Good job.
Okay. Release the tourniquet. Move the tube.
Good job, Tanaka.
Okay.
Now you got your blood.
Now put your fingers on this for me. And hold it above your head. Okay. gonna be good. You make sure to discard the needle properly in the sharps container and any bloody specimen. Alright, you want to make sure that you label the blood in front of the patient. So on the label you write the name, date of birth, and the date it was drawn. The field of medicine that I want to go into is oncology. Oncologists are doctors who specialize in the diagnosis and treatment of cancer. Oncologists must have good bedside manner and be able to make fast and effective decisions. Going through this medical assisting course has helped me gain a wonderful insight into the field of medicine. Not only do I get to work closely with doctors, but I also get to work with a variety of patients. This will help me when I become an oncologist because I will have to work with people from various backgrounds. Also in this medical assisting course, I have studied an immense amount in medical terminology, the proper performance and technique of procedures, and much more that will help me throughout my journey to become a doctor. In order to become an oncologist, I must first complete 4 years of pre-medicine. I have chosen to attend the Rocky Mountain College where they have offered me a $25,000 scholarship. I have chosen to major in biology and also complete the rest of my requirements there for medical school. I wish to attend medical school at the George Washington University. There, I will study internal medicine and subspecialize in oncology. After that, I will serve 2 years residency at a hospital as an oncologist and also be board certified. After that, I will serve a couple more years of an internship at an oncology center getting used to the specialty. Then I will continue schooling throughout the rest of my career because in order to be an oncologist, you must keep up to date with the ever-changing world of medicine. This ROP medical assisting course has impacted my life in such a great way. Not only am I leaving high school with a potential career, but I have also gained insight to what it's like to be in a college class and also what it's like to be in the medical field. I am leaving high school fully prepared and aware of the challenges that I will face. Thank you so much to the Riverside Office of Education for giving me this magnificent opportunity.